Hi, well, thank you for joining me today, and I have just want to take a few moments to talk about BBL, Brazilian butt lift, or fat transfer to the buttocks, and some of the recent information that we're learning about this procedure. I'd like to share with you today and some of my thoughts. Recently we've seen an increase in demand for this procedure, and when it's done correctly, patients are quite satisfied with the result. There's a really noticeable difference in the shape, the profile, and overall satisfaction. However, there has been, and rightfully so, some increased attention given to this procedure, specifically looking at the technical aspects as well as the safety profile. Unfortunately, there have been some complications, even deaths associated with this procedure, and I don't want to scare you, but I do want to inform that this does involve a intimate understanding of how to safely perform this procedure, which is to safely remove fat from the body, process it, and then re-inject it into the buttocks. What happens during this process, if it is done incorrectly, the fat can get into the circulation and plug one of the branches in the lung and cause issues. Now, our society has come together along with the Aesthetic Society as well, the American Society of Plastic Surgery, and formed a task force really evaluating this procedure and has made some recommendations. They even went and studied the anatomy in cadaver labs, and basically what the recommendations are is to place the fat only in the fatty layer and not into the muscle. By not injecting the muscle, you avoid the larger veins and potential complications from this. So I think that's a very important topic and discussion point. And during my consultation, I do discuss this with my patients about this particular point, because I think it's very important that we not only review the indication, but also possibly some of the issues that can come with that. Now, some ways to help with the placement also is patient positioning, keeping the special equipment, and also there's ligaments in the buttock area that can be released that also can help facilitate fat placement. Again, I only place fat into the fatty layer and do not place it into the muscle, and that is going to essentially eliminate this risk. So bottom line, if this procedure is done correctly, it can be a very safe and rewarding aesthetic outcome. Please seek out a board-certified plastic surgeon prior to having this procedure. And if you have any questions, you can call our office at 708-424-399, and we'd be happy to discuss this procedure in detail.